As a co-host of HSR 2020 and co-lead of its program working group, it gives me great pleasure to participate in the closing ceremony of this remarkable journey. I want to thank Professor Sarah Bennett, the co-chair of the program working group, and all the program working group members for the exceptional efforts that they put in this symposium. This is an opportunity to reiterate the significance of the symposium theme and to reflect on some of the key messages emerging from the HSR 2020. So today I will be sharing with you some structured reflections and key messages and learnings and insight that we got from the 3 phases from HSR 2020. Now, we know that since HSR 2018 in Liverpool, the world, in fact, that as we know, has changed dramatically. And this is something that we really need to acknowledge. A lot of changes has happened since then. HSR 2020 comes at in fact, defining moment as health systems across the world are under tremendous challenge and pressure from the COVID-19 pandemic. The symposium theme initially was inspired by 2 observations. Certainly, 2020, marking 10 years on from the first global symposium, but also 10 years away from the 2030 Sustainable Development Goal agenda. Symposium seems even more relevant now and timely as COVID-19 uncovered long-standing gaps in health systems and also exposed more and more chronic inequity. There's also a collective realization now that health systems, as they stand today, are not equipped to address increasingly complex and interconnected health and development challenges of today's world. If we go to the theme, which is really about reimagining health systems, it's very clear that it's about time to reimagine health systems and to go beyond the sick care to a reorient system to preventive services and public health. We need to think and reframe health beyond the biomedical disease model. We've learned from these 3 phases that we need to engage and we must engage with the upstream political, social, economic, and environmental forces in order to address inequities and social injustice. We also learned that we need to acknowledge and address power imbalances in a global health institution. We need to explore the potential of technological data and social innovations in redefining health systems governance, financing, and delivery arrangement. Also, we've learned that we need to broaden conceptual and methodological toolbox of health policy and systems research. If we go to the key insights and learning that we got from the sub-themes, certainly for sub-theme 1, related to engaging with political forces, we've learned from all these speakers and plenaries that we must speak truth to power, politics, and corruption, from the frontline service provision to societal structure and global corporate interferences. We've learned that we need to analyze and understand multiple ways in which power manifests, powerful actors and how powerful actors work. We need to actually, and this is the challenge of hidden and invisible power. We also learned that we need to recognize that power is not always a bad thing. However, for power to be effectively deployed, it needs to be held accountable. One of the key insights as well from sub-theme 1 that, acknowledging that the abuse of power and corruption thrives when transparency, accountability, and participation are weak, when public sector capacity are low, and decision-making is jeopardized by conflicts of interest and politics. Still within sub-theme 1, we need to start creating the conditions to promote accountability and enable stronger social voice and collective action to challenge existing power relations and address corruption. When holding power to account, we need to also confront the power behind the power that most influences and shapes public policy, such as large corporations, powerful financial institutions behind them. We also learned that health system governance need to be strengthened. We need to redesign incentive systems and adopt whole of government or whole of society approach and institutionalize the use of evidence. COVID-19, no doubt, is really a powerful reminder that many determinants of health are now beyond the control of national governments. We need to acknowledge and address global political determinants of health. For sub-theme 2, which is really engaging social, economic, and environmental forces, certainly population mobility and migration came and was very powerful in all the discussion and deliberations. The importance of geopolitical, this is important geopolitical phenomena, and it is a core challenge to universal health coverage and sustainable development goals. When it comes to population mobility and migration, there's a limited understanding in how the mobility and migration population shape health system use and how health systems need to adapt. COVID-19 certainly exposed health system inadequate response to population mobility with discrimination and exclusion. Health systems need to adapt to increasingly mobile population. We need to better understand how migrants' health needs and health-seeking practices are affected by the intersections of other structural determinants, to become more responsive to migrants and refugee health, and certainly health systems need to be inclusive of the different migrant groups. The universal healthcare coverage need to go beyond the basis of borders and citizenships. This is some of the key things and learning we got from sub-theme 2. Still, within the sub-theme 2 under urbanization, we've learned that rapid urbanization is really reshaping social and economic life, and with it, human health and health systems. There's a growing number of urban residents in informal settlements and urban slums, lack of access to public health infrastructure and vital health supporting services. Certainly, COVID-19 also magnified the level of inequality faced by these vulnerable groups. The failure of practical and conceptual approaches to address intersectoral challenges and the ubiquity of informality in Global South. We've learned that we need for health system to engage with the social, economic, and environmental realities of informal settlements and urban slums for healthy and inclusive urban settings. And no doubt, there's a need for multi-sectoral action that places health at the center of urban policy. For the climate change, certainly the impact of climate change on health and health systems already happening. We know this is really happening. The poor and marginalized are mostly affected. We need to promote a climate resilient health systems. We need to consider the potential for planetary perspective that recognize interconnected systems. In this case, climate change affects health system by impacting planetary health. The need for whole system thinking and more fluid response across human-animal environment interface and geographic borders. And certainly the need for reframing national lens through which health systems are conventionally viewed, and normative understanding of health systems and the health sector issue. To go to sub-theme 3, engaging technological data and social innovation, certainly the potential to improve service delivery, payment, consumption, and administration of healthcare by redefining how people and systems and information interact. COVID-19 also amplified the need for better governance of digital data, data privacy, security, and responsible data management. We need to think about supporting pillars like rules, laws, regulation to enable and protect governance. We need to consider the factors that make technological intervention successful, looking at evidence, local support, the fit for context, targets those most in need, and scalability. We need to invest in health information system and local data. Same thing for artificial intelligence and big data as the really greatest disruptors of healthcare, but cannot replace compassion, sympathy, and understanding, which are the core of patient-centered care. So cross-cutting, if we look at the cross-cutting theme and from all these sessions, and most of the sessions and plenaries related to sub-theme 1, 2, and 3, certainly the need health policy and system research discipline to broaden the conceptual and methodological toolbox to ensure health policy and system research remains relevant and impactful. We need to leverage on frameworks, principles, and theories from other disciplines. We need to cater to evolving roles of actors at all levels of the health system and the reorientation towards working with the powerless and those affected by research in terms of participatory as well as co-production. We need to institutionalize efforts to promote uptake and use of evidence and data in decision making and action. And more importantly, we need to move beyond rhetoric when it comes to multi-sectoral collaboration and to enable a whole of government and whole of society approach to tackle priority issues. And we've learned a lot about the importance of multi-sectoral collaboration given the COVID-19 pandemic that we are currently living in. And this is really in terms of how we see the way forward. And I want to quote here, the pandemic is a portal. And this is Arundhati Roy, which writes that the pandemics have forced humans to break with the past and imagine their world anew. So this means that we cannot really walk backwards in the future. The world will only look significantly different if we decide to take action now and resolve underlying causes of health inequities and social injustices, bring about fundamental change to old ways and old systems. Now is the time to be radical in both our thinking and actions, and these are some key insights and key learning that we got from HSR 2020. We need to be radical in our thinking and actions. The end of HSR 2020 is only the start, that you will carry the conversation, aspirations, and lessons forward. Thank you so much.
Good day from Melbourne. My name is Barbara McPake. I'm the director of the Nuttall Institute for Global Health at the University of Melbourne and the chair of the Health Systems Global Board. 2020 marked the 10th anniversary of the first Global Symposium on Health Systems Research. There was much excitement that our 6th edition would be hosted for the first time in the Middle East, in Dubai. However, as the global scale of COVID-19 emerged, and with HSR 2020 only 6 months away, HSG and partners, after careful consideration and consultation, took the decision to transform HSR 2020 into a global virtual event running over 3 phases and 5 months. It was a big decision. To build on and adapt the tremendous amounts of high quality work already invested in the scientific program, HSG and partners sought to develop a focused and engaging virtual experience based on principles of effective and inclusive digital convening. We sought to harness the strengths of digital technology whilst recognizing where it is more challenging to replicate face-to-face interactions in digital form. The HSR 2020 theme, Reimagining Health Systems for Better Health and Social Justice, felt even more appropriate and timely, and was harnessed to embrace new thinking at a key moment for health systems around the world. The results were impressive. HSR 2020 attracted 2,350 participants from 125 countries, with more delegates than ever participating from low and middle income countries and from nearly all regions, and 70% of people participating in a global symposium for the first time. Without the high costs of international travel and the commitments of supporters, HSG was able to award 1,190 scholarships, removing registration fee barriers for many participants who may not otherwise have been able to take part. Through its web-based virtual symposium platform, all HSR 2020 sessions were available on demand to participants. HSG also utilized its YouTube channel to broadcast multiple free-to-access sessions to a global audience. Participation by HSR 2020's online virtual platform was further built upon via the symposium's social media reach and engagement. The official symposium social media hashtag HSR 2020, featured third in the top hashtags used by the scientific community on Twitter during the week of HSR 2020 Phase 1 in November 2020, behind only the likes of hashtag COVID-19. Whilst the hashtag for the 5th Global Symposium in 2018 had over 6 million Twitter exposures, the HSR 2020 hashtag had 11 million exposures through Twitter alone over the same period. We will draw upon the independent evaluation of HSR 2020, a summary of which is available via the HSG website, and the experiential learnings of so many people involved in the preparations and delivery of the Global Symposium, so that HSG and partners can strive together to shape future international convenings, not only in the shadow of the COVID-19 and perhaps other future pandemics, but so that we take collective responsibility for responding to a global climate crisis that necessitates adaptation and innovation. Each Global Symposium on Health Systems Research is a major process of engagement and community building within and beyond the Health Systems Global Membership Society. The Global Symposium represents a 2-year process of consultation and mobilization with the aim of building capacities, partnerships, and networks, regionally and globally, to both shape the symposium and to be sustained and built upon into the future. There are so many people we need to thank for their vital and hugely appreciated efforts and support. First, our co-sponsors of HSR 2020. Our local host partners, the Mohammed bin Rashid School of Government in Dubai and the K2P Center at the American University of Beirut. Throughout the process, we've been mindful of how important the opportunity of hosting the Global Symposium was for the Eastern Mediterranean region, and so we're immensely grateful to them for their support and understanding as the COVID-19 pandemic forced us to transform HSR 2020 into a virtual symposium. And we also want to thank colleagues at the Dubai Health Authority for their support over the last 2 years. To our co-sponsors, the World Health Organization and the WHO Eastern Mediterranean Regional Office, and our long-standing and valued partners at the Alliance for Health Policy and Systems Research. A special thanks to Abdul Ghaffar for all he has done for the field of health policy and systems research and for his tremendous support for HSG over the years. We thank him and congratulate him on his successful leadership of the Alliance. To all our supporters, in particular the Doris Duke Charitable Foundation, Canada's International Development Research Centre, and the Bill and Melinda Gates Foundation, for their commitment and support throughout the reimagining of HSR 2020. We truly could not have delivered HSR 2020 without you, and thank you for your continuing backing. To our journal partners, the OUP in Health Policy and Planning, Biomed Central, BMJ Global Health, and BMJ Open, who work with us to not only make HSR 2020 a success, but also together on several other initiatives that complement the Global Symposium. The Program Working Group, led by Sarah Bennett and Fadi El-Jardali, who painstakingly developed the symposium program, and the many members of the Scientific Committee, without whom the peer-reviewed process that shapes the program would not have been possible. The Emerging Voices for Global Health for working with HSG and partners to transform their own biennial convening of yet another exciting and inspiring group of young professionals from around the world in tandem with HSR 2020. Their energy and engagement still resonated through HSR 2020, despite the virtual format. Thanks to the Logistics Committee and our 2 PCO partners, MCI Dubai and ABI, for all their hard work. It has been pleasing to hear lots of positive feedback about the support their teams provided to participants. So thank you for stepping up to the challenge of delivering a virtual symposium. We thank the Communications Committee members for their support in the transition to a virtual experience and their important role of digital communications in making the symposium an engaging virtual experience. Thanks go to our Fundraising Committee for their tireless follow-up and ensuring support for the symposium, to the members of the Executive Committee, several of who have already been mentioned, for coordination and oversight of the efforts of the subcommittees and taking all the decisions that mattered for the success of the symposium. Thanks to the incredible hard work of George Gotsadze, Nanuka Jalagonia, and the rest of the HSG Secretariat staff at the Curatio International Foundation in Tbilisi for orchestrating so many of the foundations for a successful HSR 2020. And to Eva Slawecki, Sarah Brown and colleagues at the Canadian Society for International Health in Ottawa for smoothly taking the reins for the concluding steps of the 6th Global Symposium. Thanks also to Tom Barker and the team at the Institute of Development Studies in Brighton for working closely with both Secretariat teams to convert HSR 2020 into a virtual symposium and for promoting participation and engagement. Thanks go to the HSG board members for their leadership and strategic advice throughout preparation and delivery of HSR 2020. And most importantly, we're indebted to all of our HSR 2020 participants and HSG members for their commitment, support, and engagement throughout HSR 2020, including as we pivoted to an online symposium. It is your contributions, insights, debates, and discussions that make each global symposium, including HSR 2020, what it is. Despite being unable to meet, network, and socialize in person, we hope you found HSR 2020 a valuable experience and will remain engaged with HSG and with future global symposia. Now to look ahead. By the beginning of May, all recordings of sessions from all 3 phases of HSR 2020 will be available free to access on demand via the HSG YouTube channel. HSG feels it is important for the valuable knowledge, learning, and insights shared during the 6th Global Symposium to be available to everyone concerned with health system policy, practice, and research, wherever they are, now and in the future. Please look out for news of the collection going live in the coming weeks. As we say goodbye to HSR 2020, it's time to begin our preparations for the 7th Global Symposium in Bogotá in 2022. We're excited to be hosting the Global Symposium in Latin America for the first time, and I know so many of you feel the same. The work towards HSR 2022 has already begun, and today marks one of the first and most key elements of the preparation, the call for ideas to help shape the symposium's theme. I am delighted to welcome Dr. Paul Andrés Rodríguez Lesmes to announce the call and welcome you to Colombia.
We, the LOCA's host partners from the 7th Global Symposium on Health Systems Research, are excited to be welcoming you all to Bogotá, Colombia from the 31st October to 4th November 2022. Ahead of this, we are pleased to invite all HSG members and stakeholders to contribute their team ideas for HSR 2022 in Bogotá. The purpose of the Global Symposium team is to, first, focus attention and motivate participation in the symposium. Second, shape program development and abstract selection. And third, inform global debates and national agendas. We want to hear your thoughts on what will be a theme that will attract you to contribute to and participate in the 2022 symposium. Please go to the HSG website and social media channels to share your ideas. The link to contribute can also be found in the text beneath this broadcast on YouTube and in the description of this session if you're watching via the HSR 2020 Virtual Symposium platform. You have until Friday, 23rd April 2021 to give your suggestions. And remember, don't forget to use the hashtag HSR2022 when messaging about the next Global Symposium on social media, so that you can reach and engage peers and colleagues. We hope you will join us and members of the health policy and systems research community for across the world next year in Bogotá.
Latin America is a diverse paradise with lush rainforests, former colonial cities at sea and in the mountains. But at the same time, it faces great challenges, including overcoming inequality to guarantee access to health services, particularly in areas with precarious infrastructure. Tropical diseases are a constant public health risk for populations in urban cities and for those in rural towns. Long-standing social and political problems impose additional burdens, such as poverty, corruption, and violence. The collaborative and tireless efforts of the region have allowed us to tackle these challenges, which have been compounded by the coronavirus pandemic. As a result, we have adopted innovative technologies and promoted dialogue and the harmonization of knowledge. In Colombia, the 1991 Constitution was the starting point for the structural reforms that shape Colombia's health system today. Since then, health has been at the center of the public policy agenda, and the country continues to move forward in this crucial process of important collective construction. The armed conflict represents one of the longest wars in Colombia's history, and its impacts are visible among the vast health and social inequities present throughout the territory. Since signing the peace agreement in 2016, Colombians have a deep yearning to achieve peace and welfare within its communities. The country has made significant strides towards universal health coverage and shows substantial indicators of progress, particularly in financial protection and health service development. However, today the population and various social organizations are demanding more effective, comprehensive, and equitable access. It is critical to build a concerted, forward-looking vision of the health system, one that is multidimensional and inclusive of its citizens' needs, to reclaim its public character, to strengthen public health, and to improve governance. With this in mind, the Colombian health system makes for a valuable case study and object of analysis, especially within the Latin American environment and the Global South.
El Instituto Nacional de Salud, como entidad asesora del Ministerio de Salud, ha sido testigo de excepción durante 103 años del desarrollo del sistema de salud en Colombia y en la región. Ha aportado al hacedor de políticas públicas mediante la investigación en salud pública, los análisis complejos de información y, por supuesto, la vigilancia epidemiológica.
The region will be proud to receive the HSG Global Community in Latin America, home of significant healthcare reform during the last 30 years. This occasion will allow regional researchers and policymakers to share their experience and carry them through in public policy intervention. See you all in Bogotá in 2022.